I'm Deb Angerami. I'm the CEO of Phoebe Putney Memorial Hospital. I'm originally from Albany, New York. That's where my family is from, a small Italian neighborhood in Albany, New York. And I moved down to Florida after college. I had gone to college right basically on Lake Erie, so it was freezing. So I could not wait to get away from the lake effect snow and the cold, and then went back to the University of Florida for graduate school. So got my MBA and my MHA, Masters of Business, Masters of Health Administration there. And then my first job out of graduate school was at Health First. I started there as an administrative resident, which is basically like a graduate intern, and I stayed there for 22 years. So I stayed there for the entirety of my career up to this point. The huge trajectory in my career came when I was serving as an administrator for a small hospital, 84-bed community hospital, and our patient satisfaction scores and our quality scores were absolutely not where they needed to be. So we did a huge turnaround. We got those scores from the bottom decile in the country up to the top decile in the country in probably less than 24 months. That's when my role expanded from one hospital to two. And then we did the same thing at the second hospital, Cape Canaveral, and then it went from 2 to 3. And then we did it at 3 hospitals, and then it went from 3 to 4. It was a great 22 years that I really am incredibly grateful for. But I don't think I would have left if my dad hadn't gotten sick. Unfortunately, my dad was diagnosed with Lewy body dementia in 2021. It was a very devastating disease, and I resigned from my position at Health First to take care of him and to be there for my family. And ultimately, he passed away in May of 2022. After about 2 months, I started to look for other opportunities. Really felt like I had more to give. I wasn't, ready for retirement. The minute that I talked to the recruiters for this position, I couldn't stop thinking about it. I just thought it's such a unique hospital. It gives so much back to the community. And there were just great opportunities to do even more. I also saw some things here that frankly I have not seen anywhere. The vision around the sim lab, the learning center that is coming, I just think that is a genius strategy for creating a pipeline of nurses. And then there were things that I felt that I could do and could do well from my prior experience in terms of increasing our focus on patient experience, increasing our focus on patient safety. It was that juxtaposition of, wow, there are some amazing things here that I'm going to learn a lot from this system, and then there are things that I feel like I can bring to the system and assist the community and the system with continuing to increase our performance. One of the things that I asked the board when I came here was, so what do you like about this community? I'm new, what do you like? Every single person said, we may have differences of opinion, but when the chips are down, this community supports each other. We are here for each other. Being in a pretty violent car accident with no family here and no friends outside of work, the way that the Phoebe family has treated me and has taken care of me is unlike anything I've ever experienced. And so, I think a lot of companies or organizations throw out the term, we're a family, but I've never seen it exemplified the way that I have here, even before my accident, but certainly after my accident, where folks are bringing over anything I could possibly need, when folks are offering to walk my dogs or take my dogs in, or going and picking my dogs up from the emergency vet because I'm laid up and couldn't do so. I've just never seen a community or organization rally like that around someone, and it's something that I feel like is incredibly special. There have been so many times in my first 5 weeks here that as I left work, my overriding thought is, I'm exactly where I'm supposed to be, and I'm so happy that I picked Phoebe